Good afternoon. This asynchronous webinar is a pre-recorded presentation that will be made live on July 7th, 2020 for the Health Resources and Services Administration's Government Project Officer and JBS International, the National Technical Assistance Provider. On behalf of the Communities of Practice, Rural Communities Opioid Response Program in Ohio, the Culturally and Linguistically Appropriate Services Standards Workgroup welcomes the opportunity to share our experience with you and how we utilized a learning community model to take a deep dive into exploring the CLAS standards. And we did this as a precursor to addressing stigma with opiate use disorder in 5 rural communities in Ohio. My name is Laura Malazzo, and I'll be serving as the moderator for today's presentation. We have representatives from 4 of our 5 local consortia who will be presenting today. Each will take a minute to introduce themselves, tell us about their backbone organizations, something their organization or community is known for, and a recent big RCORP win. Then each will share their perspective on one of 4 questions regarding the CLAS workgroup process. Finally, we will wrap up with an acknowledgement and an opportunity for questions. I will get us started with the introductions. I am a senior project manager at Ohio University's Voinovich School of Leadership and Public Affairs. For the past 17 years, I've been working to develop the capacity of local leaders through networked learning community approaches. Prior to moving to Ohio in 2003, I worked for 9 years at the federal level for the Department of Health and Human Services in Washington, D.C. At the Centers for Medicare and Medicaid Services, I oversaw and coordinated a number of federal grants, and those were focused on engaging healthcare providers in learning how to use data-driven planning and utilizing continuous improvement processes. Ohio University and PIRE, the Pacific Institute for Research and Evaluation, we collectively serve as the backbone organizations for the COP-RCORP Master Consortium, which has braided funding from 2 HRSA grants. One thing we are known for is hosting cross-collaborative learning communities, including virtual video work groups and workshops. One of the biggest wins so far has been the integration of the CLAS standards into our work to ensure we equitably address health disparities with substance use disorders. I'm now going to turn it over to Charlotte for her introduction.
Hello, I'm Charlotte Stonerock from Sandusky County Public Health. I'm the project director for Sandusky County's local COP-RCORP consortium. We are located in Northwest Ohio, midway between Toledo to the west and Cleveland to the east. The county seat is Fremont, best known for the Rutherford B. Hayes Presidential Center, which includes the Hayes Home, Museum, Tomb, and Spiegel Grove. For the HRSA Planning and Implementation Grants, we are supported by the Sandusky County Public Health Department and have incorporated into our local health partners organization. Since the initial phases of the HRSA COP-RCORP project in 2018, we have been able to distribute over 500 doTERRA disposal bags to our community. I will now hand it over to Robin.
Good afternoon. My name is Robin Reeves. I am the Deputy Director for the Mental Health and Recovery Services Board of Seneca, Sandusky, and Wyandotte counties. The board is the backbone organization for this COP-RCORP grant. We are located in Northwest Ohio, directly south of Sandusky County. The county seat is Tiffin, which is known as the education community. There are 2 higher education universities located in Tiffin, and Seneca County has a total of 6 public school districts, 1 private school district, 2 charter schools, and a technical school. Our local consortium is our Seneca County Opiate Task Force. During the COP-RCORP planning and implementation process, we have had the opportunity to include prevention at the table for the first time. This has been a great opportunity to educate some of our community leaders on what Seneca County has been doing in prevention, and it has opened up many opportunities. I'm now going to hand it over to Miriam.
Ashtabula County is the largest county in the state of Ohio, and we're located in the northeast corner of the state with both rural and urban-like communities and some of the best beaches on Lake Erie. Ashtabula County Mental Health and Recovery Services Board is the backbone organization for our Ashtabula County Substance Abuse Leadership Team, which is the organization that's involved in the COP-RCORP grant project. Our work with Ohio University and PIRE through the collective impact model has allowed us to strengthen and expand our local collaborations and partnerships, and has given us the ability to normalize behavioral health as a public health problem and be intricately involved in our public health assessment and our community or our county health improvement project. And I will now turn that over to Tony.
Hi, I'm Tony Ashton, and I'm a licensed social worker and an Ohio certified prevention consultant. I have worked in the social service and prevention field for 40 years. I have experience with the strategic prevention framework and the community collective impact model. I am the prevention coordinator at the Fairfield County ADAM Board. The Fairfield County ADAM Board, which is Alcohol, Drug Addiction, and Mental Health Board, is the backbone organization in this project. Fairfield County is located southeast of Columbus, Ohio, and we have a population of 157,000 people. Our residents are proud of the rich Fairfield County heritage, including both cultural and natural sites. Cultural sites include things like museums, covered bridges, and historic homes, including the home of General Sherman. Natural sites include Mount Pleasant or Standing Stone, being the gateway to the Hocking Hills, and of course the Fair Fields, which is where our county's name originated. Our local consortium, the Fairfield County Opiate Task Force, consists of representation from a wide variety of agencies, organizations, businesses, and community members. Our biggest win related to HRSA P and HRSA I would be increasing our membership and strengthening our opiate task force in a very focused manner. All members of our task force come from different perspectives, but they are all focused on the substance use disorder issue. I will now transition it back to Laura.
Thank you, Tony, and the other co-presenters. So for today, as a work group, we brainstormed and developed 4 questions that we thought would best describe the CLAS work group and processes that we undertook. And what you see here are the 4 questions that we came up with. So for the first question that's in the fuchsia color there, we will discuss why we decided to break the HRSA core activity number 2 into 2 parts of class and stigma, and share why it was important for us to address class before we could begin addressing stigma. For the second question in gray, we'll focus on how the work group structure supported learning about class and how working collaboratively with one another benefited each of the leaders and their community. For the third question in green, we will share how addressing and promoting class has impacted communities, especially now in response to the COVID-19 pandemic. And then finally, we will wrap up the presentation by sharing why we developed a position statement and how we plan to use it in guiding our work moving forward. First up, we will have Charlotte from Sandusky County, and she is going to discuss the importance of understanding class standards before addressing stigma.
For the Prevention Core Activity number 2 from COP-RCORP Implementation Grant, we split this core activity into 2. As a group, we felt it was important to address CLAS first as a way to improve quality services and to help eliminate healthcare disparities by being aware of a person's culture, language, and level of education. Also, to use several means of getting the information out to the communities we serve, to include various media platforms and print materials. By addressing and practicing class standards first, we will be able to effectively move forward to address stigma as it relates to opiate use in our communities. I'll hand it back to Laura.
Okay, great, thank you. Now we are going to turn it over to Robin from Seneca County, who's going to discuss the benefits of approaching CLAS as a collaborative learning community.
Thanks, Laura. Today I have the opportunity to talk to you about the work group structure and how we utilize learning communities. Group learning has many benefits. First and foremost, we have had the amazing opportunity to have a supportive technical assistance team from OU and PIRE to be able to help us really be able to absorb and understand the class standards. Then we look at the multiple community structure. The benefit of having multiple communities working together is that each area may be different. However, we can share our thoughts, what has worked and what has not worked with each other, and adapt those ideas to fit in our own community. For example, when we were first looking at the class standards, one of the communities shared how they were able to have their website translated to multiple languages. We loved that idea and felt that would be something we could utilize in our community and are currently working on that. Once COVID-19 hit, this group became a great place to share what our communities were doing to ensure that resources were getting out to all of the different populations, especially the more vulnerable ones. We were able to help each other brainstorm new ideas to make sure that we were remaining culturally competent and inclusive. When you bring multiple communities together, it benefits everyone and creates a unique learning environment. I'll now hand it back to Laura.
Great, thank you, Robin. So let me advance the slide here. Now we are going to turn things over to Miriam from Ashtabula County, who is going to discuss incorporating CLAS into their rural community opiate work and how they are utilizing CLAS with the COVID-19 realities.
Yes, I'd like to highlight how addressing CLAS impacted Ashtabula County, especially in response to the current pandemic. It guided us to look at our community differently, looking more closely at poverty, our communities of color, and our challenges based on the size of our county, because Ashtabula County is the largest county in the state of Ohio by square miles. The CLAS standards gave us a new perspective that led to gathering new sources of information on at-risk populations and how to quickly respond based on the needs of those populations. At the beginning of our work with CLAS, we implemented a linguistics evaluation of all of our public education materials that increased our awareness. We began to ensure that all of our communications could be consumed by members of our community, as well as addressing health disparities such as access to services and supports. In response to COVID-19, we reached out to support services where face-to-face interaction was still taking place. Places like EMS, emergency management services, were able to help us gather a lot of information. We developed a resource guide and other CLAS-compliant materials that we've distributed to them where people are at. Again, through EMS, food banks, school lunch programs, senior service grocery delivery, and many home-delivered meals. Churches, homeless shelters, and hospitals are just examples of some of the places we were able to distribute the materials during the pandemic. And I will now pass it back to Laura.
Great, thank you, Miriam. So now we're going to turn the virtual mic over to Tony from Fairfield County, and she's going to share how we are planning to adopt CLAS in a sustainable approach. Tony?
Thank you, Laura. As a learning community, we wanted to develop a CLAS position statement so we can have an effective guidance document and good cross-communication. It will also provide us with a shared language within the master consortium and the local consortiums. A master consortium CLAS work group was formed, and we examined different examples of position statements, including the National CLAS Standards Principle Standard, and from Ohio State resources from the Ohio Mental Health and Addiction Services, the Multi-Ethnic Advocates for Cultural Competence definition of cultural competence, and Disparities and Cultural Competency Committee. As a learning community, we all gave input and feedback on the position statement. Each community then approved the position statement. So specifically in Fairfield County, our CLAS standard work group met, reviewed, and approved the master consortium position statement. Our plan was to take this to our full local opiate task force to discuss and ask for approval for use locally when COVID-19 started. As we are working through the pandemic, we are taking into consideration the CLAS standards. When our local opiate task force is able to meet again on a regular basis, we will review, discuss, and hopefully approve the position statement. When our local consortium resumes, we will also move forward with providing a CLAS standards training. The next slide you'll see is the approved position statement for you to review. So I will now transition it back to Laura.
Great, thank you, Tony. I appreciate that perspective. And I think you highlight what we really found through this process, which is the importance of CLAS being integrated into all of our work and activities. We're excited about beginning to plan how to address the very complex issue of stigma. And I know that all of the knowledge, skills, and attitudes we've gained from this collaborative deep dive into looking at the CLAS standards has put us in a position of strength as we think about embarking on that next step. On behalf of the entire CLAS standards work group, the COP-RCORP Master Consortium, and the Training and Technical Assistance and Evaluation team, I want to thank you for this opportunity to present the CLAS work group and its process.